Hello, I'm Professor Robert Bristow, Director of the Manchester Cancer Research Centre. I'm sorry I can't be with you at this year's Greater Manchester Cancer Conference. I'm actually at an early detection cancer conference in Portland, Oregon, where a number of institutions around the world are trying to understand how to detect cancers earlier and actually one day prevent them. What I am excited about is to talk about some of the programs that are ongoing in the Manchester Cancer Research Centre around equality, innovation, and collaboration. Let's first talk about equality. One of the mantras of the Manchester Cancer Research Centre is to provide precision cancer medicine for all. That means all types of people, all types of patients, and of course, all types of different backgrounds that our patients may have when they come into our clinical care setting. I'm very excited that we have this as one of the underpinning pieces to our cancer center, because it really says that we are trying to maximize people's engagement in clinical trials, an understanding about the different biologies that might occur from one ethnicity to another, and really put that all together with a formula to give the very best care to each one of our patients amongst the diaspora that exists within the population of Greater Manchester. And that's an important element to the next generation of precision medicine. If patients are taking drugs for other health problems and have other health problems, how does that affect their precision medicine? If people are from different ethnic backgrounds, does that put them at differential risk for cancer? And also, of course, does that mean differential response to treatments because maybe their cancers have a different genetic makeup than other cancers? And we know that actually is true for some cancers, for example, from the African continent, based on some of our work now in Kenya. And finally, how do we make sure that all clinical trials are available to all people? Well, that's to make sure that instead of having people come to us, we go out to the population. We explain what those clinical trials are about. We engage in fact-finding and myth-busting relationships with the populations in terms of making sure that if they have questions about research, that we can answer those. And we do it in partnership and co-creation with the fantastic populations in Greater Manchester in order, again, that we deliver to the Greater Manchester populations. Another exciting area that we're working on is really that of cancer research innovation. The MCRC, or Manchester Cancer Research Centre, has always been about team science. And the reason that we do team science is we bring together patients, researchers, and the clinical teams in order to come up with new ways of addressing problems with respect to cancer risk, cancer treatment, and living with cancer. And that means that there are specific ideas and specific impacts that Manchester can make relative to any other city in the world or any other institutions in the world in terms of changing around the tide of the effect of cancer on families and individuals. For example, one of the areas we're very interested in is what I call the Digital Cancer Center. How do we actually, in partnership with patients and populations, take the best data from our patients and put it together to provide that precision medicine for all piece that I talked about? Part of that is to collect data in collaboration with patients so that they understand the data that we are collecting and also give us permission to use it in a way that gives us the best personalized medicine for patients. Again, including data around potential family history, around specific other drugs that are being used for their other health problems, and those other health problems, and potentially even where they live in terms of the potential risk for cancer. Part of the Digital Cancer Center concept also is to move cancer care not only within the Christie Hospital or other hospitals, but actually to take it into the home. So the concept of a cancer hospital at home is now being approached by our digital experimental cancer medicine team, in which either blood tests or clinical trial results with respect to symptoms can actually be inputted by having devices in your home and actually driving forward some of that information using a smartphone device. And Manchester is leading in that area. We're certainly collaborating with a number of networks in the United Kingdom to understand how best to use the data with our patients. But I'm very proud of one exercise, which is the Patient Data Promise at the Christie Hospital, where we work with patients to talk about how we bring together the data to actually change their care in a way that's much more personalized. So these innovations are very important in addition to the technical innovations, because actually the control of data, the privacy of data, the security of data is very important to patients. We understand that, and we hope to be leaders in the way that we use, again, this complex data to improve our outcomes in an innovative way that actually leads then to a change in patient care within the United Kingdom and across the world. And finally, let's talk about collaboration, both at a national level and an international level. So why are we seen as a collaborative choice? Well, the first is that we offer unique aspects of cancer research in terms of having a Greater Manchester Cancer Plan, having devolved healthcare and aligned cancer treatment pathways through a conurbation of 3.5 million people. Whether that's our radiotherapy network with CR UK, Cancer Research UK, RadNet, or that's our early detection program with Cancer Research UK Alliance for Early Detection, the reality is that that large population allows other institutions to validate inventions, to ask joint hypotheses together, and those global challenges in early detection and innovative ways to use radiotherapy are therefore provided by joint solutions, sometimes actually led by Manchester. And then internationally, we have, again, similar collaborations of choice with Kenya in terms of early detection of cancers within, again, an African healthcare system, collaborations between our researchers and Kenyan researchers to provide answers for Kenya by Kenya, and then more recently, answers that we'll have together in precision medicine with the Peter MacCallum Cancer Institute, as well as the Princess Margaret Cancer Centre, in terms of areas of rare tumor biology, areas of early detection, and again, advanced materials. So the best minds are when you have the opportunity to pull it all together and actually have an impact at an international level, but it may start off at a national level in this particular case.